Good morning. I'm going to talk about EKG today. It's ECG or EKG. Let's see, we have a heart structure. So this one is the right side and that's a left side. There are two atriums, there are four chambers, two ventricles, two atrium. So when all the blood comes from the body through a superior vena cava, inferior vena cava, it all comes here, goes to ventricle, then goes to lungs, get oxygenated here, right? So the blood here get oxygenated, comes back to the left side of the heart, right? So it comes to the left atrium, and then from here it goes to a left ventricle and then goes to the body. So this through the aorta, all oxygenated blood goes to the body. And we have, if we look into the this is basically telling you the different parts of EKG rhythm. So when both atrium contracts, they contract together, remember that. So when this one contract, blood comes to this side, then this contract, the blood comes to the left ventricle. So both atrium contracts together. When they contract, that's called a depolarization, right? So contraction, the other name for contraction is depolarization. So when this both atria contracts, you get a P wave. You see here P wave, that's because both atria are contracting. Then both ventricle contracts, you get QRS, right? So there's a QRS you get when both ventricle contracts, and we know the ventricles are very stronger, very muscular. That's why you see QRS is little longer. And then the T, we get it when the ventricles are actually resting and is filling up. So that's the time you get T wave. So revise again. P wave is due to atrial contraction, QRS is due to ventricle contraction, and contraction is also called depolarization. T wave is when the ventricle relaxation, which is called repolarization. So R and R is easy to remember. So this one is a normal sinus rhythm. You have a P here. That's actually a P, not R. Let me fix it. So that's a P. So you get P wave here, right? You get P wave, then you have QRS, then T. Again P, QRS, T. P, atrial contraction, atrial depolarization, QRS, ventricle depolarization, T, relaxation or repolarization. So that's called a normal sinus rhythm. Then we also check for the PR interval, which start from the P starts until Q. That's called PR interval. Remember, it's until Q, it's not until R. So that's called PR interval, and it tells us from where the rhythm is coming. So if rhythm starts here, so we have a SA node. If you see our heart here, so in our heart we have a two atrium. We have a SA node here, which is our pacemaker. So impulse start from here, it comes here. While it's traveling, this both atrium contract. So this one is our SA node. Then we have a bundle of his here, and then after that we have Purkinje fiber, right? So this one actually spreads like this. So we have a SA node, which is our pacemaker right here. We have, sorry, this is this is SA node, and this one is AV node. I think I wrote this wrong. This is AV node, SA node, AV node, bundle of his, and I have in my other CD also, so other video also, bundle of his and Purkinje fiber. So this is the way impulse start in the heart, and it kind of travel here and travel here. Because the impulse start, that's why both atria contracts, and then the time it takes from SA node to AV node is actually PR interval, which is from 0.12 to 0.20 seconds. And QRS time, the time it takes for the impulse to come here and help in contracting this ventricle, that total time which takes here so impulse to go is 0.06 to zero point 0.1 second. So how do we measure? We use, you might have seen it, we measure it on a graph paper. So let me tell you, the smallest part on the graph is 0.04, right? So in next some of the videos we'll see how we measure this one. So I'll just end this video here. If you have any question, contact me.